Toby Stark Associates Insurance Agency here. I got a question this week of, can I buy a Medicare supplement at any time? And the answer is yes, you can. And just to be clear, the Medicare supplement policy is connected to original Medicare, and its purpose is to pay for what Medicare doesn't through what's called auto adjudication. And there are many misnomers out there about a Medicare supplement policy, in that it dictates your care. It can refuse your care. What if my doctor doesn't take it? So those questions have been brought on by individuals before they were 65, for about 45 years have been on managed care, where the insurance carrier decides if this procedure is medically necessary, you need a pre-approval or prior authorization, you had co-pays, you have a deductible, you have a maximum out of pocket. Does your doctor participate in the network? So that's what you've been doing your entire working life, essentially, not knowing any better. A lot of you have probably worked for an employer and have had an application put in front of you to sign up for benefits, and you didn't know really what you were getting, but you know that was part of your package when you signed on. So now is the time for consumerism, and now is the time to overeducate yourself and learn about what a Medicare supplement policy is. And part of that is the Medicare supplement policy stands in the background and is called on when Medicare needs it. What you're doing is, as you turn 65, you're transitioning into what's called original Medicare with two parts, Part A and Part B. Part A is hospitalization and Part B is doctors and outpatient. Now, the Medicare supplement policy is delivered to you by a private insurance carrier. Medicare is, through your tax dollars, hardworking dollars, is offered to you when you turn 65. So it is a government benefit that you have paid into that you're going to take advantage of. And that government benefit is different than the private insurance you've been on prior to 65. So Medicare would be your primary payer, not the Medicare supplement. What's primary? That's first. Medicare will be first to pay, and as long as a procedure is medically necessary, Medicare will pay. The providers don't necessarily contract with the Medicare supplement plans. They contract with Medicare. For example, you go to see a doctor, Medicare will pay. If there's any overage, they will auto adjudicate after they communicate to the supplemental carrier. The supplemental carrier will auto adjudicate the funds to Medicare, and Medicare will pay the provider. So it's important to remember that all you need to ask your doctor is, do you accept Medicare? Because the misnomer is, well, I have a Medicare supplement, so what happens if they don't take it? Or I don't like that company. Or, well, Medicare is the primary payer, and you will happily enroll into Medicare. So that was kind of long-winded, but I just wanted to get to the point of, you can enroll in a Medicare supplement at any time, and I just wanted to clarify what a Medicare supplement is. So Medicare supplement takes care of the 20% that Medicare doesn't pay for. And also, when you enroll any time in the Medicare supplement, in most areas, in most states, the Medicare supplement plans are underwritten, which means you have to pass underwriting before you get the policy. Unlike when you were 64 and younger, when you just jumped on a plan, because that's called guaranteed issue, and you cannot be refused from any carrier due to health or any conditions that you currently have at this point. But Medicare supplement plans do underwrite, unless you're aging in for the first time and it's your initial enrollment period, or IEP. Then the insurance carrier cannot underwrite you and cannot ask questions. So you can get any plan you want, and you can change to any plan you want during that time. When can the insurance carrier start underwriting you? It's 6 months after your birthday month, your initial enrollment period closes. So you can still, as long as you're healthy, change Medicare supplement plans any day of the week as you see fit, although it rarely happens. You just have to pass underwriting. So you have the freedom and flexibility to enroll in the Medicare supplement and change whenever you want. You just have to be healthy. And also, these supplemental plans, the benefits don't change on them. This is what you're going to get, so you're familiar with that plan and that policy. And the plans offered across different insurance carriers are going to be identically the same. The price may be a little bit different depending upon the appetite for that insurance carrier in the certain market, how that's priced. And also, you want to take a look at what have their previous increases been in the market, and then we could also help you figure out in the future, we want to place you with the best carrier that has premiums that are steady for longer. It may not be the least expensive, but you just don't shop right down to the bottom of price. Those that live by price will die by price. I can guarantee you that. So in conclusion, you can change Medicare supplement plans whenever you want. It's just you have to pass medical underwriting to do so. And when you're in your initial enrollment period, turning 65, you want to make the best choice possible so you don't have to get on the carousel and go round and round and try to make a decision to change your Medicare supplement plan. That's not what you really want to do. It's there for you. When Medicare pays, it will pay. Thanks again.